From the Leeds Grenville Lanark District Health Unit, I'm talking with the Medical Officer of Health, who happens to be Dr. Linna Lee. And there has been conversations as well as press releases out there about a merger. So let's talk about this with Dr. Lee and find out more. Welcome to the program.
Hi, it's good to be back.
So how many public health agencies are mentioned in the merger that the ministry is talking about?
Yeah, so there's not been a specific number. There are 34 health units across the province.
Okay.
What the province has said is that health units that are relatively large are not going to be part of their merger initiative. So it's really the smaller health units. Tentatively ballpark number, about 500,000 population or less.
Yes.
Certainly we're part of that. Our population in the LGL region is about 180,000.
Yeah, we're a little low. We're a little low, right? So yeah. So there is a possibility then of the local health unit actually merging with some surrounding area.
Yeah,
units.
and so the province has provided us with some objectives as well as some overall considerations. One of them is looking at a population that would be 500,000 or more. Now, there are a number of objectives and considerations, so it's not that we have to meet every single one of them,
Right.
but we should think of them as a network of elements, and one of them is that population piece.
Okay.
It does mean, when we're talking about population, for example, Ottawa well exceeds 500,000,
Yes,
their
yes.
health unit,
Yes.
and so they're not part of this provincial initiative at this time.
So if we were to merge, who would be the likely units that we would merge with?
Yeah, so the province, one of the other considerations that they've put in their documents to us has been contiguous health units. So what they mean is, that share some sort of physical border.
Okay,
and so we can
geographically.
Yeah, exactly.
Yes.
And
All
so
right,
we
that
can
makes
take a
sense.
look at our map of surrounding health units, and there are a few health units around us. Eastern Health Unit to our east, Renfrew Health Unit to our north, in Ottawa as well, but I just said
Ottawa's by themselves.
Yeah. And then to our west, we have KFLA, so Kingston, Frontenac, Lennox, and Addington is the health unit.
Yes.
And then because we're in the eastern region, the last health unit that I'll mention is Hastings Prince Edward. And the names of the health units are based on the counties that they serve, and so they give you a sense of geography. Now, in the way that we've talked about mergers up until now, things are still tentative.
Oh,
and
yes.
So nothing has been determined or written in stone. As a health unit, we do continue to speak to all of our neighboring health units on what it means to go forward with the provincial initiative. And one of the other things is that we have specifically spoken to the KFLA health unit and the HP health, so Hastings Prince Edward. In our 3 health units, there has been joint agreement to go forward with that proposed combination to see what next steps hold. Now, what next steps hold is essentially to say, does it make sense to continue to investigate this merger? And so, in our recent joint press release, we talked about a potential and further investigation. So really what that means is we'll be looking at our 3 health units
Right.
to see, the governance structures. So that's our boards of health,
Yes.
our organizational structures, the culture of the organization, our vision for the work of the health unit and public health. Lots of these different elements to see, does it make sense to go forward with merging?
Right.
If it does, or, it's a bit of give and take, right? So part of the question as to whether it makes sense to go forward
Yes.
is also what is our joint vision for going forward, and whether all the component health units, so these 3 health units, can agree with it, can all sign on. Now, this is tentative discussions. Each of them has to be taken back to our individual boards of health to see if there's endorsement, there's agreement, and then there's going to be lots of different iterations of planning moving sort of forward step by step. And then at some point there would be a decision, does it indeed make sense to merge or not? And all through this process, connecting back and forth with our individual boards of health, with our staff and organization, as well as with the people that we serve, the communities that we serve, our partner organizations, municipalities, as well as in parallel connecting with the province, since this is their initiative.
Right. It's when the announcement came down, I thought to myself, well, are they trying to what is the real reason that they would want to merge? Is it because of the care that each unit is giving? Is it all similar? Does I was trying to understand and trying to make sense of it myself. And so this voluntary merge, if viewers, we're not there yet, if you should decide to go forth, how will we benefit here in Leeds and Grenville?
Yeah, so what does it mean for us, and why would we agree, right? So these are the big questions, really the questions to consider when we talk or think about mergers. So first of all, in terms of the purpose, from a provincial perspective, part of the purpose is to provide greater structure and efficiency. That's what they've talked about, and capacity for the health units. And what that means locally would be, for example, having what we call surge capacity. So COVID-19 is an example, but we've had lots of other events happen at the health unit, even in the past year, where there's been greater demand for our services, greater staff demand. And because we run quite lean, there isn't always capacity to meet surges in demand. And so a larger health unit or a larger organization provides you with greater flex to be able to have that capacity. So that's part of what we're taking as the term efficiency. The other is we have had overtime. Currently, we're actually staffed quite well, and but over time for ourselves as well as other health units across the province, remembering that this is a provincial initiative, not just for us. There has been challenges with, in particular, highly skilled or highly specialized individuals, of which there might only be one or two in a health unit. And if you have challenges with recruiting those people with those very specific skills, then they may sit vacant for some time. And so a larger organization would give you a little bit more sort of overlap and reinforce that skill set over a sort of more people being able to be in those same roles. So for us as well, we have that vulnerability. Although we are well staffed now, there are certain positions, as with all organizations such as this, there are certain positions that are really key and require a great deal of specialization, for which if we lost that position or that person, there would be potential gaps in service. And so preventing that, that sort of backup. And then the third is the larger organization. So as with other organizations, right, you might have a person doing things off the side of their desk, or a person doing things, only part-time. In a larger organization, you might be able to consolidate that into a full-time person, or a person who's not doing it off the side of their desk, but is actually a substantial part of their work. And a lot of that work can be done at a more regional structure. And those are things that we could potentially benefit from in a larger organization.
Yes, it's being able to be flexible and be able to have that expertise when required.
Yes,
so it does
absolutely.
make sense. there.
Yeah. So those are the things that we'd be looking at to see, where are the benefits? There are, of course, also going to be potential risks or downsides. And so
yes.
how do we balance those?
Right.
And then also, aside from benefits and downsides, just change, right? So how do we manage that? All of those would be considerations that we as an organization would be looking at our sort of partner organizations and then bringing to the board for that ultimate board decision.
So, what is the next step? What happens now?
Yeah, so I've been sort of living this. The provincial announcement came out in August, and so there's been a lot of just like little things, right? And so that joint media release that we provided across these three organizations was the kickoff for up until now it's been legwork. So now the next steps.
Right.
So the first next step is there is a submission to the province. There's a number of structures as to what needs to be submitted to the province. That will be coming sort of in the spring-ish of 2024.
Yes.
And so up until then, there will be a need for us to do more legwork, right? So the due diligence for the board to understand what are the key considerations? Are there things that are critical as sort of deal breakers?
Yes.
Are there things that are critical as important positives for going forward? And then just the practical day-to-day of, understanding who does what in these different organizations, how the process will work.
Yeah, and how you work together.
Yeah,
on
exactly.
This.
Yeah. So all of that between now and sort of the spring of the new year. And then at that point, there would be a submission to the province as to what we consider to be benefits, what we consider to be risks, what mitigation can be, will need to be done. And then from there will continue. So that doesn't sort of, we're not signing on any dotted lines at that point. There would be responses and back and forth with the province. And then there would also be work as to, if we go forward with a merger, then what would it actually look like, right? Between now and March, we won't necessarily, that's not enough time to get us there, but down the road, thinking about what services we provide, whether it makes sense to look at joint service provision in a way that we don't do currently. Important things that we've talked about certainly at the board as well as across the organization is what does it mean to continue to provide really excellent public health services in the context of a larger organization. I've been thinking and talking a lot about local service provision because a lot of the work that Healthy Nets do, and certainly our Healthy Net as well, is going to people, going to restaurants and going to, and clinics, all of these things that need to be in person. And as well being embedded in the communities that we're in. That's really important.
Well, it is important, and there's no way that you can just zoom into a kitchen of a restaurant.
No. You got to see it right in person, and you gotta ask those sometimes uncomfortable questions.
Thank you for coming in and sitting down with me today. I really appreciate you talking about this merger and telling our viewers what is happening, so that they know it's going to take a while. It's not something that's just going to happen tomorrow. So thank you for being with me.
Thank you.